Hello guys, it's second unit and it's part D. Now the types of the pelvic. These are the 4 types of pelvic or the 4 variants of the pelvic. These variants are also known as impairments. First, gynecoid pelvic, anthropoid pelvic, android pelvic, platypoid pelvic. The common abnormalities of pelvic is gynecoid pelvic. This is seen in 50% of the female, while anthropoid pelvic is seen 25% of the female, but android is seen 20% and platypoid is seen 5%. Next, ischial spine. If you see the structure, ischial spine is present here. In gynecoid pelvic, ischial spine is blunt. Blunt in the sense those are not sharp. They are in this shape. In android pelvic, they are projected. Projected in the sense they are sharp. The tip is sharp. And next, in these 2 places, ischial spine is empty because in these 2 spots, ischial spine is normal. In gynecoid pelvic, the inlet is oval. It is round in shape. In this way, you can see here. Actually, this is the inlet. It is kind of oval, open, round. You can say this is the inlet shape. When it comes to anthropoid pelvic, the inlet is kind of egg shape. When it comes to android pelvic, the inlet is kind of heart shape. When it comes to platypoid pelvic, the inlet is kind of flat shape. Next, subpubic angle. This angle here between the 2 pubis, this angle is known as subpubic angle. Between these 2 pubic, there is an angle known as subpubic angle. Here in gynecoid pelvic, subpubic angle is 90 to 100 degree. Here in anthropoid pelvic, subpubic angle is narrowed. Narrow in the sense it's very small. It's not wider. The opening is not proper. It's very small. In android pelvic, here the subpubic will be less than 90 degree. Here in platypoid pelvic, subpubic will be wider. Wider in the sense open. The degree is more than 90 degree. Next, sacrum. If you see the structure, you'll get to know sacrum is here. This is coccyx and this is sacrum. Okay. Here the sacrum is wider. Wider in the sense it is large in shape. Here sacrum is long and narrow. Here sacrum is long, but it is narrow in shape. Narrow in the sense it's small. Here in these 2 sections, sacrum is normal. Here sacrosynetic notch is wide. Sacrosynetic notch. I'll show this in diagram. What is it part? This sacrosynetic notch is wide. Wide in the sense open. I mean it's big this way. Here also sacrosynetic notch is wider, which is open this way. Sacrosynetic notch is narrow. Narrow in the sense it's small. Sacrosynetic notch is narrow. Narrow in the sense this way. Small. In these 2 conditions, it is wider, it is big. In these 2 conditions, it is smaller, it is narrow. This is the variations of the pelvic. I will provide questions after completing this whole chapter. That's it for today guys. Let's meet in the next video. Until then, stay tuned.